Okay, so the next topic that we want to talk about is the experience, like what you're going to experience during the procedure. We're going to be doing a type of anesthesia called sedation. So anesthesia, as you can see on the little graph here, is a continuum from a patient that's wide awake at the top of the line or the arrow, all the way to the bottom of the arrow, which is a patient that is unconscious, which is also called general anesthesia. So the unconscious patient is usually treated in a hospital. As we get deeper and deeper asleep, it becomes more dangerous, and we need to have an anesthesiologist in the room to take care of the patient. So for you on your surgery day, we're going to be in the middle, which is called moderate sedation or middle sleep. So at the very top of the line on the graph, it's a patient that is lightly asleep, and then where the X is in the middle, it's a moderate amount of sleep, and then finally deep sleep at the bottom, and then an unconscious patient. Again, along the line, everywhere along the line, as we get deeper and deeper sleep, there's a possibility of having more anesthesia complications. So we will be in a middle sleep or medium sleep for you. What does that mean? So moderate sedation or middle sleep, the patients that I see are usually snoring. So the patients are unconscious, but if I were to call your name or I tapped you lightly, open your mouth, you can hear me and you'll do that. So there is some awareness. Level of awareness is very, very minimal, and any response that you have will be very quick. It'll last a few seconds, and then you go back to sleep. So as far as handling any pain, it's done with local anesthetics. So that blocks all the pain pathways. If we add numbing inside the mouth in all 4 quadrants, your mouth at the end of the procedure when you wake up at home is going to be numb from the tip of your nose to your chin. The bottom third of your face is going to be completely numb and have no sensation. So during the procedure, there is no pain at all, but you can feel pressure because it's moderate sedation. So we have to make sure that we are clear about the distinction or the difference between pressure and pain. So with conscious sedation, you can feel things, like you can feel pressure, but you kind of know what's happening, but you don't care. If that is a good description. That should be helpful as far as like what your experience is going to be. So again, you can feel things, but no pain. You will have no memory, so the medication that we give you causes profound amnesia. Most patients remember nothing at all. They just wake up at home and wonder how they got there. Or they have a minimal amount of memory where they might remember 10 seconds here or there that something happened or that I was talking to my assistant. That's about it as far as like what your experience is going to be. Of course, I will meet with you in person and we can answer any questions that you have.